Senator from Queensland. Susan McDonald is one of them. She joins us live from Townsville. Looks like, are you in hospital still, Susan? I'm just wondering how your treatment's going.
Thanks, Annalise. Good to talk to you. No, under the current protocols, Queensland Health sent me home on Tuesday afternoon. I went into the hospital on Monday afternoon when the results came back positive. But I was really a terrific disappointment to the infectious diseases specialists and didn't have any symptoms that they could treat or even monitor, really. So after a day, I was sent home and I'm staying here.
What were your symptoms that led you to think you might have COVID-19?
Well, on Friday morning, I noticed that I had a dusty kind of dry throat. And Friday afternoon, I felt unwell, you know, when you feel you're starting to get a temperature. I had the Cowboys-Broncos game on that night and I didn't want to risk infecting any of those people, so I thought I should do the right thing. Peter Dutton had tested positive that day. I hadn't been in contact with him recently, but I thought it was the right thing just to go and be tested and to rule coronavirus out. And so when the results came back on Monday afternoon, I'd self-isolated at home, obviously, and hadn't gone to the game or anything else. But when the results came back, I was probably as surprised as anybody. I was feeling reasonably well and really thought it would be so unlikely that I would have it.
So how did you find the treatment process going to hospital? I'm guessing you were a priority case for them, being a senator?
Well, no, I don't think I was a priority for being a senator. I was a priority for being their first positive tested case in Townsville, the state in Townsville. So I was just extraordinarily impressed with the professionalism, the organisation and the systems that all of the staff demonstrated. And I think Townsville, at least, is in very good hands. They've had the opportunity to try out a few protocols, how people get tested, where, and we've smoothed out a few systems. So, you know, Townsville is well prepared and well organised. But one of the things I would say, Annalise, is that every single person who'd spoken to me in the previous 2 or 3 days did present to be tested, and that has put a great deal of pressure on the testing regime on Townsville. But it is important that you be tested if you have symptoms. If you don't have symptoms, then you are potentially testing too early, and they will not be reliable results. But more importantly, those people who are vulnerable, who really need to be tested quickly, can be seen, can be tested quickly.
Do you know how you got it?
I have got no idea at all, Annalise, and unfortunately there's no red flag or identifier for when people are sick. So I really don't, and I have travelled a lot in the last 2 weeks. But, you know, there haven't been any other positive results from the other towns I've been in. And so I'm thinking I really don't have any idea. It's a pretty big speculation.
Do you know if they are undertaking any contact tracing to see how you got it?
Yeah, absolutely. So I supplied a list of everybody that I've met with in the last few days. I've provided my diary for the last week. And people, you know, because I am a public figure, anybody who's met with me in that time has certainly proactively contacted Queensland Health or their local hospital or GP and had a discussion about whether or not they should be tested. I'm really delighted that you know, some of the people that I know of have let me know that they've come back negative, which has been a great sense of relief to me. I am very conscious of the people who have potentially seen me and could have contracted the disease, and certainly what the public health officer, what Brendan Murphy is saying, holds true for us all. We need to stop shaking hands. We need to wash our hands frequently. We need to maintain a 1.5 metre distance from people. For those of us in North Queensland, that's all a bit, it's all seen a bit of a over precaution, but I know that how I behave going forward, I'll certainly be very mindful of that, because it won't be about me, it is about the people I see and keeping people around me safe.
Absolutely. And just finally, so you won't be coming to Parliament next week, obviously, if you're in home isolation. Do you know when you'll be coming back to Canberra?
No, I don't. I have just had my second negative a swab, so the virus has cleared my body, but I'll obviously stay in home isolation longer than that. Some people have suggested that this was a very dramatic way to get out of estimates hearings, and just want to assure you that that is not the case.
Would be very understandable though. Susan McDonald, thank you for your time live there from Townsville.